This briefing outlines the clinical presentation of the homeopathic remedy sulfur, categorized as the King of Psora. Identification of this archetype depends on a triad of symptoms: severe thermoregulation failure, an abrupt daily metabolic crash, and pronounced poor hygiene. Recognizing this specific triad allows a practitioner to look past the patient's chaotic, unkempt exterior to find the underlying constitutional structure. Mentally, the subject embodies the ragged philosopher, characterized by deep, highly speculative, and often obsessive thought. This psychological profile is dominated by sulfur pride, a delusion where the subject perceives their unwashed, tattered clothing as fine royal silk. This is often paired with a profound physical aversion to water, manifesting as both hydrophobia and a refusal to bathe. The result is a stark clinical paradox, a mind harboring delusions of royalty while willingly inhabiting a state of neglect. Physically, the subject cannot tolerate prolonged standing. For this archetype, remaining upright is their worst physical torture. The thermal map on the right illustrates a severe daytime inversion, where the head runs intensely hot while the extremities remain freezing cold. At night, this thermic profile shifts. Once horizontal, the soles of the feet burn so intensely that the subject must uncover them to find a cool spot on the bed. Their metabolism follows a similar clockwork failure. At 11 a.m., energy levels plummet into an empty pit stomach crash that can lead to fainting. These are not minor daily fluctuations, but aggressive systemic failures that dictate the subject's entire routine and physical capability. The primary external hallmark is intense redness, specifically at the bodily orifices, including the lips, eyelids, and anus. The skin presents an agonizing cycle, severe itching that transitions immediately into a burning sensation after being scratched. The subject also emits a pervasive, rotten egg odor that resists any attempts at washing. The external presentation is defined by this inescapable irritation and permanent biological exhaust. Accurate identification requires looking past the superficial raggedness to the underlying structural indicators. This summary matrix captures the diagnostic markers: water aversion and pride, the 11 a.m. hunger crash, burning soles at night, and red orifices. The convergence of these metabolic, thermic, and psychological markers reveals the clinical profile of the King of Psora.